Hey everybody, it's Dr. McWilliams with McWilliams Vein Center. I've done a few posts recently about some of the myths associated with vein disease, and there's several surrounding pregnancy and vein disease. So we wanted to take a moment and kind of do a little bit of a deeper dive on pregnancy, venous disease, and some of the reasons that veins worsen during pregnancy and some of the things you may see during or shortly after your pregnancy that could be a little bit misleading. So I think what we're going to do is just throw out those misconceptions right off the bat, and then we'll address them as we go through the rest of the video here. One of the common misconceptions is that pregnancy causes vein disease. Pregnancy does not cause vein disease. Genetics is what causes vein disease, but pregnancy can speed up the process quite dramatically. And we'll go over some of the reasons why. Another common misconception, which unfortunately the medical system is largely responsible for, is that you have to wait until you're all done having children before you get your veins treated. In the old days, when the only option was vein stripping, that's what we used to tell our patients. But there are much better treatment options available now. And because of that, there's no need to wait until after you're done having children. And in fact, it's detrimental to wait. You should get them treated as soon as you know they're there, even if you plan on having multiple pregnancies. The third myth that we want to address, and this is something that many women can attest to, especially if they had vein disease during their first pregnancy. After you deliver, the veins look a whole lot better. They decompress, a lot of them go away. So a lot of women think, my veins are gone, therefore I don't have vein disease, and it's not something I need to worry about. But we're going to talk about that too as we go on, because once a vein is abnormal, it's always abnormal. So let's talk briefly about what does cause vein disease. The veins are supposed to return blood from the tissues within the superficial system into the deep veins and then back to the heart to eventually go out to the lungs and become reoxygenated. But this is an uphill climb. So the veins rely on a series of one-way valves to make that happen. The valves are normal, everything works fine. Unfortunately, some people have a genetic predisposition to have bad valves. This allows blood to flow backwards, increasing pressure and inflammation, weakening vein walls, leading to varicose veins and inflammation. That's what causes vein disease. So why does it seem like pregnancy causes vein disease? A lot of women will tell you, I didn't see any veins at all until I became pregnant and had my first child. Well, there's two things that are there's two parts to that answer. One is increased circulating blood volume. During pregnancy, you have a dramatic increase in the circulating blood volume because you're supplying oxygen and nutrients to the baby as well as yourself. The other thing is hormones. Every woman has fluctuations in their estrogen and progesterone levels that vary throughout the menstrual cycle. There are times when estrogen and progesterone are high, and that's why some women will tell you there's certain parts of their cycle where their legs feel worse when they do have symptomatic vein disease. It's that increase in progesterone, particularly. Progesterone causes veins and arteries to dilate and proliferate. And that's great for the placenta and growing a nice, healthy blood supply to feed the baby. However, when you have abnormal veins or you have valves that are kind of just hanging on, and then you dilate that vein, those valves are no longer functioning correctly and they're now broken. During pregnancy, progesterone levels skyrocket. They grow multiple times. And that's going to cause a lot of dilation in your venous system. So if you have valves that have given way or they're just about to give way, but maybe they haven't yet, you dilate those veins a little bit and now those valves have failed. So pregnancy speeds up venous disease when you have that genetic predisposition. When you deliver, there is a dramatic drop in progesterone and estrogen levels. So, a lot of the distension in those veins and your circulating blood volume decreases dramatically right after you deliver. So, a lot of the veins look like they disappear. Unfortunately, once a vein is broken, it's always broken. It does not go back to normal, even if it is decompressed and it's no longer as visible as it once was. So, a lot of women will fall into the trap of thinking, yeah, I had vein disease during my pregnancy, but after I delivered, all my vein disease went away, so I don't need to worry about it anymore. That's not true. Those veins are still there, they're still abnormal, they're just not as distended and visible, but you're going to see them show up during your next pregnancy. So here's what this looks like to people. During your first pregnancy, you get some vein disease and then it goes away after delivery. You think second pregnancy is going to do the same. Reality is, that's what happens during first pregnancy. Second pregnancy skyrockets to where it was, worsens, and then it never really goes back to baseline. And that brings us to the final aspect. We used to tell women to wait until you're all done having children before you treated your veins. Again, this is no longer the advice that we give to our patients, and any of you OB/GYN docs out there, need to understand that that's based on old, outdated treatment methods. The methods we have today are very safe, very quick, very effective when they're done correctly. So, women would benefit now from having vein disease treated before they ever have any pregnancies. Some vein disease will recur because of the hormones of pregnancy, and then after delivery, we treat that. So, you should treat before pregnancy, you should treat in between pregnancies, and eliminate any of those abnormal veins. There's enough going on during pregnancy that you have to deal with. Vein disease should not be one of them. So give us a call at McWilliams Vein Center where you're treated like family.